Hello everyone. I am Sridharan, Assistant Professor from the SNS College of Physiotherapy. In this video, one of my students who is going to present a case sheet about a condition which is known as disc bulge.
Hi, I am Renuka, BPT final year student from SNS College of Physiotherapy. My case presentation is about Mr. Varadarajan, age 65 years old, retired school teacher, who was diagnosed with lumbar disc bulge. At the level of L4 and L5. I met this patient during my clinical posting at Kumaran Medical Center, Coimbatore. This patient came with chief complaints of low back pain for past 6 months and pain radiating in the left lower limb for about 2 months. The patient was gradual in onset, dull aching in nature, and increased with activities like bending forward, prolonged sitting, or standing for long periods. It was relieved by lying supine. He also experienced tingling and numbing sensation along the back to the left thighs and calf, but have no bladder or bowel involvement. He has a past history of hypertension for 10 years, which is controlled with regular medication. There is no history of diabetes, trauma, or spinal cord injury. His appetite and bladder movement is normal. On general examination, the patient had a moderate body build and adopted a slight lumbar lordosis. His gait appeared guarded and slow. On inspection, the lumbar lordosis was flattered and there was a mild paraspinal muscle spasm without any swelling or deformities. On palpation, tenderness was present over the L4 and L5 intervertebral space. Under the lumbar, paraspinal muscles were tight. Range of motion assessment showed that lumbar flexions was limited to 45 degrees and extension to about 10 degrees. Both painful lateral flexion and rotation were also mildly restricted. Neurological assessment revealed decreased sensation along the L4 dermatome and mild weakness of the extensor hallucis longus with muscle power graded 4 out of 5. The knees jerk were normal and the ankle jerk was slightly diminished on the left side. The straight leg rising was positive at 45 degrees on the left side and the cross SLR was also positive. MRI of the lumbar spine confirmed a posterior disc bulge at L4 and L5, causing mild compression of the thecal sac and the left nerve root. X-ray showed loss of lumbar lordosis with narrowing of the L5 to S1 disc base. Based on the physiotherapy assessment, the main problem were low back pain, muscle spasm, restricted lumbar mobility, difficulty in performing the activities like bending or prolonged sitting. The physiotherapy goal were to reduce pain and muscle spasm, improve spinal mobility, strengthen core muscles, correct posture, and restore functional activities. In acute phase, the patient was advised rest in comfortable supine position with the knee flexed. Pain relief was achieved using intrapharyngeal therapy IFT and most heat pack. He was also educated about in acute phase, the patient was advised relative rest. In the subacute phase, McKenzie extension exercise were also introduced, starting with prone lying and progression to prone on elbow and prone progress. A core stabilization exercise such as pelvic tilt, abdominal draw-in maneuvers and bridging were gradually included. Stretching exercise for hamstring, hip flexors and piriformis were also given to reduce muscle tightness. During the functional phase, strengthening exercise for trunk flexors and extensors were also introduced and progressed along with balance and stability exercise using a Swiss ball, gait and functional retaining were also done to help the patient to return the daily activities. Throughout the rehabilitation, patient education were emphasized, maintaining correct sitting posture with lumbar support, avoiding prolonged sitting or forward bending, taking frequent breaks and combining the prescribed home exercise program regularly. After about 6 weeks of consistent physiotherapy, the patient reported significant reduction in pain, improved lumbar range of motion, increased core muscle strength and better ability to perform daily activities. In conclusion, my experience with this case at Kumaran Medical Hospital helped me understand the importance of early physiotherapy intervention and patient education in managing the lumbar disc bulge effectively. With a combination of pain relief modalities, mechanical techniques, core stabilization and posture correction, the patient achieved a good function recovery and quality of life. Thank you.